mechanism of injury. Like, where were you sitting? How did you fall? Which leg did you fall on? What motion were you making? How high was the step? All these questions sound silly, but are of utmost importance.
Oh, shit.
Never want to hear oh shit in the operating room or in the bathroom.
I have slip discs that are pinching nerves, and I just was taking a shit.
I can't believe this is real. This feels scripted. This feels like Impractical Jokers.
Oh, why this happened?
What's your step?
Yeah, I gotta go left foot first. Go. Okay.
So discs are these padded little sacs that function in between the vertebrae, which are the bones of the spine. These sacs provide cushioning, and sometimes if there's a herniation or a bulge in these sacs, they actually end up putting pressure on the nerves that end up giving sensation and motor function to the lower parts of your body, aka your legs. So if you get pressure on a nerve from a disc bulge high up, you essentially get a pinched nerve. And then anything below the level of that nerve is impacted, which means the strength of your legs, the pain that you're experiencing, weird sensory changes, because nerves don't like to have pressure put on them.
Oh, yeah, dude.
He's getting swollen there, too.
Crush?
After being crushed between two deck boards,
Ooh.
Andy's finger swells fast.
So the problem is when you have a subungual hematoma, which is an enlarging bruise, a tumor of blood starting to spread underneath the nail, that pressure expands and it becomes problematic. Commonly, runners who experience these type of blood pockets under their nails will heat up a paper clip and actually put it on the surface of the nail, therefore melting the nail, which has no sensation, and therefore creating a hole and allowing the blood to pool out.
Andy braces himself for some old school boat medicine.
Look, they're doing it.
Sterilizing. Then we're gonna stick it. Get it done. Okay, get it done. Yeah.
I don't know why they're acting like it's gonna hurt. It should not hurt if they do it correctly.
Ow, pull out, pull out!
Cauterizing the wound can actually become problematic because when you cauterize the wound, you stop the bleeding, and then that could create a blockage, and then if the hematoma keeps being enlarged.
John Walczek has been nursing a badly infected finger.
Finger infections are incredibly problematic. There are so many places for them to spread. Think about how many different joints there are in the hand. Every connection is an area where septic arthritis can begin. The bones, the tiny little bones of the hand, that's an osteomyelitis waiting to happen. Oh, that's really bad.
So how long has it been like that?
It was brought to my attention about 4 days ago, and it was pretty well advanced. All the telltale signs: it was red, it was swollen, it was hot.
That looks like a septic arthritis. At this point, I'm starting IV antibiotics.
Did you injure it in some way?
Must have been stuck by a crab or a codfish or something, but
got some kind of cut.
So that means it's a deeper infection, because if you're getting poked by something, that means it's going deeper in the joint, makes it more likely to be dangerous. There's also toxins inside some of the seafood.
What we did is we soaked it in a warm saline solution,
Okay.
and the first time we lanced this thing, we hardly got anything out of it.
So how did you lance it?
Big sewing needle.
Okay, sterilized sewing needle, and
Yeah.
you just popped it?
Yeah.
I don't know if popping is ideal. I don't see really a clear abscess, which is a formation of pus and bacterial products inside a closed environment. I don't really see that here. I just see generalized swelling.
The next day, they worked it after a hot saline soak. It came up with a lot. And it's been coming up with a lot until yesterday.
We need a hand surgeon, we need IV antibiotics, we probably need a proper scan to see what's inside, to see if there's an abscess.
I think that you need to definitely come into the clinic. You may actually need some IV antibiotics, and I mean, this could be something that you can work
I agree.
through.
But again, with the hand, you don't want bone destruction. So you want to act early if you suspect septic arthritis or osteomyelitis.
Try to last through this walrus and get it on board.
Why are they trying to get a walrus on? What is happening right now? That water looks really cold too.
The guy's a maniac.
If Freddy doesn't get out of the water in 60 seconds, hypothermia could set in.
Hypothermia is really dangerous. Obviously, there's stages to hypothermia. You have mild, moderate, severe. The severe hypothermia can actually get so bad that it can lead to full-on cardiac arrest.
I almost had it.
Hypothermia is no joke. Even for severe hypothermia, we actually do active, like, intravascular warming in order to help people warm up, because the hypothermia can be that bad. For those who have cardiac arrest and their heart stops, we actually do like a hypothermia protocol to help slow down the cellular activity and potentially mitigate some of the damage from a cardiac arrest. Because there's some post-cardiac inflammatory changes that happen after someone's heart stops and then gets restarted.
Everything seems to be going well. And then the girls get to their second jump.
Oh,
She just twisted her ankle.
Oh my God. Can you stand on it?
that's actually a good first test to do because weight bearing immediately after the injury is one of the auto ankle rules that we use to decide whether or not a patient needs an x-ray. It's definitely like a grade 1 or grade 2 ankle sprain, just solely based on what happened, solely based on how she's feeling right now, that she's able to point. This is a mild injury because if there's a very serious tear or a very serious fracture, weight bearing is near impossible. Movement is near impossible with the amount of swelling that happens quickly, especially in kids. You obviously can't compete with an ankle like this, but it's not a very long recovery as long as you do it properly.
Looking at the x-rays, that looks like a stress fracture.
Whoa, I thought she fell on her ankle. You know what this might be? She might have an ankle sprain, and then because they got an x-ray when they might not have needed to, I don't know exactly what happened, but then incidentally also found a stress fracture from constantly jumping and doing all those things, which happens in kids.
She really needs to go all out to impress the Joffrey Ballet Scout.
I actually have had patients that come in with stress fractures of, let's say, the tibia, which is their shin bone, preparing to run for like the New York City Marathon. I diagnose them with a stress fracture. I'm like, you cannot compete in the marathon in the next 2 weeks. And they say, well, I'm gonna do it anyway because I've trained for this so long and hard. There's no way I'm gonna give up now. And I have to warn them very brutally, honestly, that by running in the marathon, you could snap your shin bone in the middle of the race. And it happens more than we'd like to talk about.
After just 14 hours in the desert, Dr. Drew Pensky is feeling severely unwell.
How you feeling?
It's bad.
If you need to vomit, go see the doctor.
They're telling the doctor, go see the doctor. I love when people tell me that.
Dr. Drew is with the camp medic.
I suspect most likely diagnosis is dehydration.
Dehydration is part of it, but what's leading the dehydration? He pointed out the symptom, but what's the problem?
Is there any point to an IV?
If I do an IV, I think we pull you off the course.
IV is quicker, for sure, and if you are not delivering enough blood flow to vital structures, then yeah, an IV is really important. But if you're just like a little nauseous, drinking water, you'll hydrate.
With severe heat exhaustion, Dr. Drew is being medically withdrawn from the course.
Wow. Bring Dr. Mike on that show.
Literally, my whole head feels bruised because it's been pounding for so long. I've been throwing up blood. It's so intense.
I thought this was just a simple migraine, but throwing up blood is something else is going on. Migraines can be so debilitating that it can severely impact quality of life. That's why there's medications that we use that are abortive in nature, meaning that they break a migraine when it starts. Ideally, you take the medication very early at the first onset of the headache. There's also medications that we can give that are prophylactic in nature, preventative. Honestly, all those symptoms are really reasons to go visit an ER.
Are you on any medication?
I'm on that birth control.
Migraines with auras, meaning that you start seeing like a little visual sign that the migraine is coming on, is actually a risk factor and almost a contraindication to not taking birth control because it increases the risk for developing a clot.
There was nothing left in me to throw up that it was like, it was really horrible.
You could actually develop something known as a Mallory-Weiss tear, which is a tear of the esophagus from constant retching if nothing's coming out. And then if it gets really problematic, it could develop into Borheave syndrome, where you get a complete tear. And obviously that's like an emergency situation.
Today you're gonna do MRI and MRA of your brain.
The times where we decide to do an MRI with contrast, there's a sudden change in frequency or intensity in headaches that have been lifelong or have a long enough history. Certain risk factors like waking up in the morning with a headache, headaches that worsen with exertion, most specifically sexual exertion. That could be a sign that there's an aneurysm there, so you really want that MRI with contrast done. Ones that happen with new neurologic features, like the vision loss that she was talking about, all those are really strong red flags that I would get an MRI.
It's just so annoying that I get them, and I wish there was like, this is why.
Some of the best evidence that we have for medications for migraines is a medication that's a triptan in combination with a nonsteroidal inflammatory known as naproxen.
Today I woke up and my hands are a bit swollen. Do you drink enough water? Yeah.
I don't know why drinking not enough water would cause hands to swell, though.
Based on the symptoms I've Googled, it looks like I have rheumatoid arthritis.
Dr. Google, a lot of doctors get very frustrated with it. And I tend not to. If you're gonna have a question, you're gonna want it answered as fast as possible, especially in the day and age of Google and ChatGPT. That being said, what you get the results of is not always accurate. That's why you need a medical professional by your side to help guide you through this. And there's all different types of arthritis, by the way. There's osteoarthritis, rheumatoid arthritis, psoriatic arthritis. All these things can potentially be happening. It's not as simple as, is it this? No, then I'm good. No, we need to rule out other conditions.
Your antibodies are positive for lupus.
In a situation like this, what we test for is inflammatory markers called ESR, CRP. Those are non-specific inflammatory markers, so they just tell us that if they're really high, there's something going on creating massive inflammation in the body, especially in a situation that comes with these types of symptoms. Then we also simultaneously do some testing to rule out conditions like rheumatoid arthritis. So you do a CCP test, you do a rheumatoid factor test. At the same time, you do anti-double-stranded DNA antibody test, which is what she is being tested positive for. And that could be a sign of lupus, which is an autoimmune condition, which does impact joints among other parts of your body. Like the classic thing is the malar rash that you get across the bridge of your nose.
I have this like rash. Chloe seems to think that I have ringworm, and I don't even know what that is.
Well, Chloe went to medical school, I'm sure, but let's see. How long has it been there?
About a week.
They look pretty plaquey. This could be an early sign of something related to the lupus. Could be psoriasis.
Well, it's not ringworm. Chloe was off. But it's psoriasis.
I mean, in order to make the diagnosis, besides looking at it, you could also look under a microscope and see what inflammatory cells are there, if any.
I have heard of it before because my mom has always had it. But, you know, my mom didn't have like red flaky dots all over her.
Some people have plaque psoriasis, which is like way more skin involvement than just that.
When I gain a pound, it's in the headlines. Imagine what the tabloids would do to me if they saw all these spots.
I'm curious what the tabloids would do. I think if you come out as a positive role model, showing that this happens to even the most beautiful people on the planet, it could be an inclusive moment, and maybe tabloids would celebrate it. I don't know, maybe I'm wrong.
And you do not have lupus and rheumatoid arthritis.
Yeah, see, I think that there was something a little bit weird with that initial diagnosis. I was skeptical.
Probably had psoriatic arthritis because psoriasis comes and goes.
Yeah, I mean, lupus comes and goes too. But like, the idea is it's not as simple as, oh, you have it or you don't have it. You need a really thorough clinical picture. You need a really thorough physical exam. And then you need some blood work in order to make a definitive diagnosis. And there are times you do false positives. This isn't a screening. When you do a screening, you're testing someone with a blood test who has no symptoms. She was having symptoms and they were trying to make a diagnosis. So this is not a screening blood test. This is a diagnostic blood test. What's harder, medical school or dental school? We actually argue about it here with my good friend, Dr. Rubenstein. Click here to check it out. As always, stay happy and healthy.
Gotta be 25 feet long. Damn it. World record's over 60.
They didn't see the tapeworm on all of the imaging that they did. This girl's case is interesting because she has this condition. She doesn't feel anything, therefore she's not aware of the tapeworm, and that's not unusual. A lot of people won't be aware of a tapeworm. But because she has this tapeworm, was not getting B12, she essentially started having neurologic complications as well as having a fever because of the infestation of the worm. And all these other symptoms popped up, but at the same time, they didn't pop up like they normally would in a healthy individual. Her presentation was masked because she has the condition SEPA. House, I'm challenging you to not flinch during my reaction video. Beep-whoop.
Still drawing those lines instead of looking at the cards.
More juice?
What's more juice? He has to ask for it.
He's choking.
Time to institute the Heimlich maneuver and stop bullying your child.
It's impossible. It's mac and cheese.
What do you mean it's impossible? What is mac and cheese unchokeable? All right, the fact that he's yelling, though, makes it a little bit less likely that he's actually choking. If you're yelling, that means you're moving air.
10-year-old boy screams for his life for no reason.
He's autistic, severely autistic.
Okay, so a child with autism, what we have is an autism spectrum disorder, and we don't know where in that spectrum this child lies.
Can't talk, can't make eye contact. Screaming's probably his way of communicating.
Yeah, you know, some children that have been diagnosed with autism, one of the challenges that they face is verbal and nonverbal communication. Some children don't have good social cue identification where they can't understand someone's emotion by reading their body language, or they can't speak themselves, or they choose not to speak themselves.
His brain can't filter information. It's a constant assault on his senses. I'd scream too.
One of the main things that go hand in hand with ASD, hypersensitivity, sometimes to light, touch, sound. And remember, while we're only naming the challenges, there are some positives that can come from a diagnosis of ASD. Some children are super smart. Some have the ability to memorize things way better than the average child. So it's not only about the challenges, it's about the strengths too.
ER checks his throat, no obstructions, nothing. which means the only symptom was a scream, which is diagnostic of nothing.
I completely agree with Foreman. You have a child who is diagnosed with autism, who started screaming, and the parents are very worried about it, and now they're doing like this giant workup with multiple specialists. I wouldn't even know what the consultation would ask of the specialists.
Stool sample to check for parasites, blood culture to rule out infection, and ANA for lupus.
Because he screamed?
I love investigating if there is an investigation warranted. You're checking for ova and parasites and lupus. You can't order tests willy-nilly because false positives are really a thing.
Dust, wheat, pollen, a toxin, or something.
It could literally be anything because right now your one symptom is screaming.
Run a lung ventilation scan. Lungs are in the chest too, right?
I had a date last night. She screamed. Should we spend $100,000 testing her?
Why did your date scream? That was a weird revelation.
Of course not. This isn't a veterinary hospital. Zing!
Actually, the veterinary hospital thing is kind of funny to me because in medicine, we oftentimes say treating kids working in pediatrics is a lot like being a vet because sometimes the children, if they're really young, can't tell you what's wrong with them. So it's almost like treating a dog who can't tell you what's wrong with them either.
You know what it's gonna be like trying to put an autistic kid into a nuclear scanner? I don't envy you guys.
In those cases, we do sedate. We give medications like benzodiazepines for temporary sedation.
Can't you sedate him or something?
Could if I didn't want the test results to mean anything.
Are they doing a CT? If they're doing a CT, you could sedate the child. I don't know why you said that the test won't mean anything. God, did they just break into people's homes all the time?
Big shocker. Dad's depressed.
And they're getting information on the parents. This is so unethical. This workup on a screaming child is gonna cost $10 million. They're gonna test his sand out of his sandbox? Who's paying for this? I can't get insurers to pay for an antibiotic if it comes in an easy to swallow capsule, and they're gonna get insurance to pay for sand testing? Come on.
Fecal matter. Is there a sample we can look at?
Parents have the smear kit, but the kid is constipated.
Go up his rear and get a smear.
Talk about creating a traumatic situation for a child for absolutely zero reason at this time. But somehow, because it's a House MD episode, he's gonna be right. I don't even know what they're looking for in this sphere. They already got an ova and parasite sample.
Adam? Adam? Adam?
So what makes fluid fill the lining of the kid's lungs?
Infection, tumor. I feel like I'm one of his students just yelling stuff out.
If there's a pleural effusion, we have to rule out heart failure.
The pleura, by the way, is the lining that covers the lungs. Organs are covered by pleural membranes, which essentially prevents the organs from rubbing all over each other. So like there's a cardiac membrane, there's a lung membrane.
Get the kid an echocardiogram. Adam?
Very hard to perform an echo as is, but to perform one on an uncooperative patient or combative patient, even harder.
What? What is it? Is his heart okay?
No. Echo suggested a conduction abnormality. EKG confirmed it.
A conduction abnormality is basically when there's a problem with electrical conductivity of the heart. So basically, in one part of your heart, you have a node that starts your cardiac rhythm and then it travels throughout the rest of the heart. The reason it has to travel throughout this conductive system is because you don't want the entire heart beating simultaneously. Otherwise, it's gonna have all the blood just splat against each other. But if you have the top of the heart beat first and then the bottom of the heart beats, then you can have like a rhythmical pulsation of the blood throughout the heart.
Get a lung biopsy.
Well, it took a half an hour to get the mask on the kid for the lung scan.
Oh, I'm sorry. Was there somewhere you needed to be?
What are they gonna do, a bronchoscopy? I don't understand how they're gonna do a lung biopsy. Like interventional radiology? What part of the lung are they gonna test? This makes no sense. This is brutal.
We want to do a lung biopsy.
Lung biopsies usually come back negative, so biopsy a lymph node under the arm.
Why are they against sedating this poor child? Sedate, please. It will not change your biopsy results, and the child will not be further traumatized by this medical experience.
Hope is what's making them miserable. What they should do is get a Cocker Spaniel. Dog would look him in the eye, wag his tail when he's happy.
Animal therapy for children with autism can actually be quite beneficial. There's less judgment that comes from animals, almost no judgment actually. The interaction that you could have with the animal is so much simpler that is an easier introduction to human interaction, which is much more complex. Horses, dogs, that kind of thing, supportive animals really go a long way for children who have autism. Not for all, but in some cases.
No cancer, because these aren't lymph cells.
Then what are they?
Okay, let me try and guess. These aren't lymph cells, so what did he get a biopsy of? A huge sweat gland, an abscess, a dermatofibroma? Oh my God, what could have he gotten? Oh, a teratoma that has hair cells in it. Oh, I have no idea.
Liver cells?
Does he have liver cancer that has metastasized to his armpit?
What's the difference between cancer cells and liver cells? Why can one pass through walls but the other can't?
Cancer cells are damaged. Lets them grow into blood vessels, go wherever they want.
So if the liver cells are damaged,
Liver isn't damaged. The tests were normal.
Well, tests on a liver being normal doesn't necessarily mean the liver is normal, because the tests that we use to check liver function, which we call liver function tests, it's actually a misnomer. They're actually liver inflammation tests that tell us if the liver is damaged, thereby releasing liver enzymes. And if these liver enzymes are elevated, then we know there's a problem with the liver. However, if your liver is so diseased that it's in the end stage of liver cancer, cirrhosis, those numbers can be normal because your liver is almost fried and there's no enzymes left to be had.
it's not his liver, his heart, or his lungs. It's the calcium carbonate in his stool.
He was constipated. Parents probably just overdid it.
Maybe he ate a bunch of chalk or Tums.
Or they didn't do it at all. Calcium carbonate's also what's in chalk.
So we ate some chalk. It isn't toxic. Sure, it didn't cause a pleural effusion.
Forget the chalk. This kid's got pica. Take him to a buffet, he's gonna eat the table.
Pica. It's a condition where you start eating things that are not edible. Paint off of the walls, mud.
Show me what you ate.
Adam?
Honey?
I don't know what that was. Some kind of sand fly or sand weasel inside of that sand.
It's a microtumor. It started in his lung, which caused a pleural effusion. Then it metastasized to his liver, which made it slough cells.
No, it has to be some kind of worm traveling throughout his body.
Hey! Kill the lights. I'm seeing them all the time.
What are you looking for?
He's telling us what he was seeing, telling us exactly what was wrong with him, drawing them for us over and over again. Hello, my pretties.
Nematodes.
It's not a tumor, Foreman. It's worms.
Aha!
swimming in his-
We said we also said everything else, so I'm not gonna even take credit for it.
Animal makes potty in the sandbox. Boy plays in the sandbox. Boy eats the sand. You can probably tell where this is going by now.
Stool samples were negative for parasites.
Raccoon roundworms are not excreted by their human host.
Cameron tested.
Bro, stop acting like you knew about raccoon poop without looking it up. I swear.
Worms spread from his gut to the rest of his body. They attacked his lungs. That's what made him scream.
I don't even care that he knew it was raccoon poop. It's the fact that he knew humans don't release it in their own fecal matter. If that information ever becomes useful to me for some weird way, I'm gonna send a thank you letter to the writers of this show.
They attack his eye and the muscles surrounding it, making his eyeball do a backflip. Laser photocoagulation to fix the eye and a high dose of benzimidazole to kill the worms.
Just think about the sequence of events here. Child that's diagnosed with autism comes in screaming into the ER. House immediately starts running tests on him and finally gets down to it that he ate raccoon poop from a sandbox. How did we get here? Hey guys, you requested House MD.
Do I get bonus points if I act like I care?
Let's get started. This reminds me of where I grew up in Brooklyn. Or is this a jail?
Why are you late?
You're not gonna like the answer.
I already know the answer.
I missed the bus.
I don't doubt it. No bus stops near Brad's.
Every medical show has to start off with some kind of sexual thing. Medicine is so exciting as it is. Why does there have to be sex? Just calm down. Stop having sex for a second.
You should never keep anything from your parents. And I told mine, cut the... What?
Oh. Are we having a stroke? slurred speech, classic sign of a stroke. Oh, problems with moving the arms.
C.
Call 911.
L. H. E. The. We know that word, the.
I'll call the nurse. Oh no. Oh, that's a seizure. She is having a general tonic-clonic seizure.
29-year-old female, first seizure 1 month ago, lost the ability to speak, babbled like a baby, progressive deterioration of mental status.
See that? They all assume that I'm impatient because of this cane.
So put on a white coat like the rest of us.
I don't want them to think I'm a doctor.
You see where the administration might have a problem with that attitude.
People don't want a sick doctor.
Now wearing your white coat, I guess it's not really a big deal because sometimes I go without my white coat and just wear my stethoscope. It's really for infectious purposes only, so that if you get any kind of germs on you, you don't bring it back home to your family, or if obviously some blood splatters on you or some other bodily fluid, I guess.
Brain tumor. She's gonna die. Boring.
That was a little cold.
She's 29. Whatever she's got is highly unlikely.
The protein markers for the 3 most prevalent brain cancers came up negative.
Tumor markers for brain cancer, that's not how we diagnose brain tumors. We use imaging, that's the gold standard for brain tumors, obviously in addition to biopsy if needed, but tumor markers are not a way to rule out a cancer.
And she's not responding to radiation treatment.
None of which is even close to dispositive.
Medically, I'm very confused. There's a patient who had a seizure. They think that she has a tumor. They did some lab work, doesn't show she has a tumor. They're giving her radiation, even though that they don't see a tumor. I cannot be more confused right now, or this totally doesn't make sense medically.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Dr. House doesn't like dealing with patients.
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
So you're trying to eliminate the humanity from the practice of medicine?
If we don't talk to them, they can't lie to us.
Excuse me, Dr. House. You can have a good conversation with patients. You don't need to believe every word they say. You can be honest. You can say you don't know, but give a plan of what you're doing about not knowing. So basically how you're getting to the answer.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Very common phrase.
First year medical school.
Lab in Trenton could have screwed up the blood test. I assume it's a corollary of people lie that people screw up.
Redraw the blood tests and get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
So a contrast MRI basically allows you to see what blood vessels are doing within the brain. The fact that they're going to a lab and questioning if the lab is accurate, we do that occasionally, but that's not the first thing we think about. I guess because this case is more complex.
I was expecting you in my office 20 minutes ago.
Really? Well, that's odd, because I had no intention of being in your office 20 minutes ago.
You think we have nothing to talk about?
No, just can't think of anything I'd be interested in.
I sign your paychecks.
I had tenure.
I can still fire you if you're not doing your job.
I'm here from 9 to 5.
Your billings are practically non-existent.
Rough year.
You ignore requests for consults.
I call back. Sometimes I
You're
miss the aisle.
6 years behind on your obligation
See,
to this clinic.
I was right. This doesn't interest me.
6 years times 3 weeks. You owe me better than 4 months.
It's 5 o'clock. I'm going home.
Doctors don't work 9 to 5s. We have crazy schedules. If someone that's more senior to us, obviously like our boss, like she is in this case, tells you to get something done, you're getting it done. But also because we have a love for the job. We want to treat patients. I don't know why he's being the sarcastic guy, but I will say it's really funny.
I'm angry! You're risking a patient's life.
I assume those are 2 separate points.
You showed me disrespect. You embarrassed me. And as long as I work here, you have
Is
no
the yelling
legal...
designed to scare me? Because I'm not sure what it is
her.
I'm supposed to be scared of. More yelling? That's not scary. That you're gonna hurt me, that's scary, but I'm pretty sure I can outrun you.
Okay, that's cool that he's popping pills on the job. Oh, this is in Jersey, Plainsboro. I work in New Jersey.
All right, Rebecca. I know you may feel a little claustrophobic in there, but we need you to remain still.
It's very true that people get claustrophobic in MRIs. You have to lay there for an extended period of time. The noise is very loud. So there are times that I have to pre-medicate my patients and give them a dose of a benzodiazepine like Xanax, most commonly, that you're probably familiar with. Yeah, it's really loud. It's even louder than this.
Feels so good.
It's all right. Just try to relax.
Oh, is she having another seizure?
Rebecca? Rebecca?
Is she choking? Is she having an anaphylactic attack to the contrast?
Get her out of there.
She probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to the gadolinium. She'll be dead in 2 minutes.
Oh, no. Get her out. EpiPen into the upper thigh. Quick.
Oh, she's ashen.
She's not breathing. Epi.5.
Come on. I can't ventilate.
Too much edema. Where's the surgical airway pin?
You're gonna need to go in the neck and do a tracheostomy. Did they give her the epi? I didn't see it. Okay, that's way too big of an incision. Okay, not exactly how that goes. If you're allergic to the contrast that they gave for the MRI, it's possible that you can get this anaphylactic attack, which means that your airway starts closing down. Basically, your throat swells up to the point where you can no longer oxygenate. Some people also vomit. Some people get very nauseous. Blood pressure drops. Her airway closed up to the point where she couldn't breathe. But because it's her throat closing up and swelling, if you make an incision in the trachea right here where there's a soft little spot for an opening, you can continue helping the patient breathe. I'm gonna call some inaccuracies here. If a patient turns blue like that, you're hitting a code blue. There's an emergency team coming, nurses, doctors, respiratory therapists. You also gotta get IV set. You gotta figure out why the patient's heart stopped or stopped breathing. There's a lot more that has to happen. You don't just automatically assume it has something to do with the contrast that you gave. And he's still popping pills. What is he popping? Hope those are Advil.
You actually want me to talk to the patient? Get a history?
We need to know if there's some genetic or environmental causes triggering an inflammatory response.
I thought everybody lied.
Truth begins in lies. Think
Okay.
about it.
So why did you tell him to not talk to the patient initially, Dr. House? Truth begins in lies just means that in order to find out the truth, you have the person lie to you, and from there you can then start making a deduction on what part they're lying about. So you need to hear the lie. That's why it definitely makes sense to always talk to patients first, regardless if you believe that they're telling the truth or not.
What are you doing?
Painkillers.
Oh, for you, for your leg.
No, because they're yummy. You want one? Make your back feel better.
No, don't do it. That's how the opioid crisis started, House.
Why are you so afraid of making a mistake?
Because I'm a doctor. Because when we make
Yes.
mistakes, people die.
Yes.
Come on. People used to have more respect for cripples, you know. They didn't really.
I can't see.
Uh-oh.
I can't see.
She's having a seizure again. So turning a patient on their side is the smartest move because you want them to, if they're gonna vomit, they don't aspirate.
Can you arrange these to tell a story?
This is a type of neurological testing to see if the person can follow a series of events.
A couple headaches last month, mild fever. Sometimes I can't sleep and I have trouble concentrating.
Apparently not while we're searching this stuff on the internet.
I was thinking it also might be fibromyalgia.
Excellent diagnosis.
Is there anything for that?
Do you know, I think there just might be. I need 36 Vicodin and change for $1.
36 Vicodin and change for $1. Oh, placebo. He's gonna give sugar pills. Oh, and he's stealing the Vicodin for himself. Again, obviously, doctors don't swap out medications. If we prescribe something to the patient, we send an order to pharmacy and the pharmacists fill the order. And we don't replace it with sugar pills for placebo effect.
You said you didn't find anything.
Everything I found was in
You
my...
found ham.
Uh-oh.
So? Where there's ham, there's pork. Where there's pork, there's neurocystic cirrhosis.
That's the condition. Bam, bam, bam. Tapeworm.
See, it fits. It's perfect. It explains everything.
But it proves nothing.
I can prove it by treating.
No, you can't. I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
That's called the principle of autonomy. Basically, that a patient has the right to refuse treatment at any point as long as they're competent. And by competent, I mean that they're able to understand the consequences of their actions. So if they say they want to go home and you tell them you can possibly die if you go home, they can say that back to you and understand what that means. They're free to go home.
For being an idiot. You have a tapeworm in your brain. It's not pleasant, but if we don't do anything, you'll be dead by the weekend. He's right. We should x-ray her, but we don't x-ray her brain. We x-ray her leg. Worms love thigh muscle. She's got one in her head. I guarantee you, there's one in her leg.
I did not know this. This is beyond my expertise and probably most doctors' expertise.
This here is a worm larva.
Wow.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee? It's there. Probably been there 6 to 10 years.
How does he know that?
Albendazole.
He's giving her a dewormer.
If anyone asks, you have 11 daughters and 5 sons.
Wait, that's 16 students. They said her class has 20. Where are the other 5? Why didn't they show up? Oh wait, 11 and 5. Sorry, the other 4. We're happy you're not dead.
I want a hug and a kiss from every single one of you. Get up here right now.
Don't give the kids the worms. I'm just kidding.
Dr. House, you have a patient. He says he needs a refill.
Got change for a dollar?
That's funny. Patient got hooked on them Tic Tacs.
House, I'm looking at you, sir. Are you gonna give me a zebra or a horse? I don't know, let's check it out on this House MD medical review.
What, are you kidding me? Tabagu, there's gotta be over 6 bills. You ain't gonna lift him with a couple of blankets.
Oh, this is
you
tough.
Better write the Einstein? Yeah, just roll him off. What, he's already dead. Ain't like he's gonna feel it.
This is actually a situation that some of my paramedic friends discussed with me about legitimately having trouble getting humans outside of their homes into the ambulance and into the ER. There's even been times that I've heard them talk about injuring themselves, bringing patients out of their homes because they were perhaps overweight or obese, or perhaps their environment wasn't safe.
All right, 1, 2, flip. Come on, man. Me, you'd have killed Boston King. Wasn't me.
Oh. Well, it wasn't me either.
Don't look at me.
Is the patient alive? Did no one check for a pulse?
Trust me, skin's cold, pupils are fixed and dilated. He's not breathing.
He's got a pulse.
He's not dead if he has a pulse.
46-year-old guy in a coma. Doesn't appear to be anything wrong with him except for the fact that he weighs over 600 pounds.
Who says that? Who talks about a patient's weight like that and says there's probably nothing wrong? Do you know that? Do you know his history? He can't even give you his full history. There's no way you could have results this quickly. Like, at least get an echocardiogram.
Blood sugar's normal. Cholesterol's lower than mine. Tox screen's clean. No sign of trauma.
Sure there wasn't a mix-up at the lab?
3 times.
I'm glad that they rechecked, because if a clinical picture, meaning what a patient looks like, behaves like, or symptoms are like, don't match the labs, you should be rechecking those labs. Too many times I've had that happen, recheck the labs and find out that they're completely normal, or the other way, completely abnormal. So I always like to keep laboratory error in the back of my mind, or in the front of my mind, the forefront of my mind. My mind.
There's nothing abnormal in the EEG or the neurological exam.
Who gets an EEG when a patient just rolls in? It's too soon. You should get a CAT scan, see what the lungs are like, get an echo, see what the anatomy of the heart is like. You should see what the digestive system is like with a CAT scan. When a patient comes in and you don't know what's going on, you have to throw all the tests at the patient in order to understand what's going on. You need to check for substance abuse. You need to check for toxic metabolites, complete metabolic panel, the complete blood count. Look at all these values and not just jump to conclusions. I mean, like doing an EEG seems like the 50th step and they've skipped over 1 through 49.
Improperly prepared pufferfish can have toxins that could cause a coma and might not show up on the tox screen.
And if it was a pufferfish, he'd be dead in 6 to 8 hours tops. He's been in a coma at least 24.
How do people know this fact about pufferfish? Come on, Foreman. You didn't know that. You Googled it. He Googled it.
This is ridiculous. A person shouldn't be able to eat themselves into oblivion and then just expect everyone to pull out the stops to fix everything.
What are we supposed to do? Refuse treatment to anyone who's obese?
Come on, give me a break. This guy's not obese. He's not even morbidly obese. He's suicidal.
People who attempt suicide get treated.
Plenty of non-compliant diabetics don't.
Wait, non-compliant diabetics do get treated. I don't know why he said that. And patients who are addicted to food or perhaps have an emotional issue that is causing them to overeat and become 600 pounds, or perhaps have a medical condition that's causing them to gain this much weight, shouldn't be judged. Like, you can't be a doctor and be this judgy and be successful as a clinician.
It's not syphilis.
How do you know?
Whatever he has is connected to his gut. Now what's below it? MRA his brain. Look for clots.
She said that the blood was drawn 3 times. In that time, they couldn't check for syphilis?
1, 2, 3.
Not gonna lie, this is a true challenge for hospital and hospital systems when patients can't fit in the equipment. That's why we are trying to create newer equipment that is more capable in handling patients of all different sizes.
Bleeds, clots, infarcts.
I don't see any edema either.
So what do we do now?
An LP. Even if it's not an STD, a fever points towards some sort of infection.
I'm not sure we can do an LP on a guy his size.
Did they get a chest x-ray? Like, if you at least had a chest x-ray, you could do that portable. You could